Now, a growing pandemic is sweeping across South Africa and it's threatening the health and well-being of millions. Now, it's not COVID-19, but rather a silent killer that's been escalating over the years. Obesity, particularly in the form of type 2 diabetes. And recent statistics reveal that type 2 diabetes incidents have doubled in South Africa, with our country now ranking among the top 10 in the world for diabetes prevalence. And this surge is largely driven by rising obesity rates, which are fueled by unhealthy diets, sedentary lifestyles, socioeconomic factors, to name but a few. So to help us discuss this further, we are joined virtually by Aspen Pharmacare Group Senior Executive Stavros Nicolaou. Stavros, always good to have you with us. Welcome to Morning Live.
Thanks very much for having me, and good morning to all the viewers.
So let's just jump straight into it because, we generally tend to discuss diabetes as, the very serious disease that it is. But let's get to type 2 diabetes in particular. How does it differ from type 1? And of course, why should we be concerned as South Africa in particular about its prevalence and incidence at this stage?
Firstly, as you correctly point out, our country has usually been known for more infectious type diseases, so TB, HIV, AIDS, and we kind of took the eye off the ball when it came to what we refer to as non-communicable diseases. So these are non-infectious diseases and include things like cardiovascular disease, hypertension, and now the single biggest non-communicable disease will become diabetes. And this is being driven by type 2 diabetes. Now, what is the difference and how many different types of diabetes are there? There are actually 4 types of diabetes. The most prevalent and predominant in our country is type 2. So let me explain the difference between type 1 and type 2 diabetes. Type 1 diabetes, which is roughly about 5% of diabetics in our country, is an autoimmune condition. Patients cannot produce their own insulin, and therefore they have these high levels of blood sugar, which causes a number of complications. So those patients have to be treated with insulin. The second and now alarming type is what we call type 2 diabetes, and this is when patients become insulin resistant. So they've got insulin, but they're becoming resistant to the insulin, and consequently you've got these elevated blood levels of glucose, or blood sugar as we call it, and that causes a number of complications. There are 5 complications. One is cardiovascular disease, such as heart attacks and strokes. The second is we're seeing an increasing incidence of kidney failure. We're seeing impaired vision, where diabetics become blind eventually. We are seeing amputation of lower limbs because they get what we call, so when I say lower limbs, I mean digits on the toes, I mean the foot in its entirety sometimes. And this is because you get what is called neuropathy, or damage of the nerves in the extremities of the body. And then lastly, you also get a number of links to all of this, to obesity and weight gain, which is what you referred to at the outset. So there's inextricably a link between obesity and type 2 diabetes, and type 2 diabetes leads to all these complications that I mentioned. And very lastly, the life expectancy of a type 2 diabetic, depending on the number of complications of any one of those 5 complications that I spoke about, can be reduced by anything between 6 to 11 years. Now, that is an alarming statistic. So if we do not bring type 2 diabetes under control in our country, we are going to face an overburdened, an overwhelmed healthcare system, which is already, we're virtually on the brink of that anyway. It will push us over the edge. It will affect our economy. It will affect lives and livelihoods, unfortunately.
So, Stavros, as you say, we need to bring this under control. Brings us to the question, can type 2 diabetes then be cured? or is this something that will linger for a lifetime?
Look, there are two things here. There are some cases where it can be reversed through diet, exercise, lifestyle changes. But the majority of patients will require treatment. There are very effective treatments out there, including, I'll come back to the lifestyle changes in a minute, but let me just cover the treatments first. There are a number of oral treatments, but there is now the emergence of a new class of drugs they call GLP-1 drugs. GLP standing for glucagon-like peptide 1. It's a mouthful. It's easier to remember GLP-1. Now, these drugs are new. They are registered in some countries for weight loss, and I cannot stress sufficiently the importance of reducing weight in managing type 2 diabetes and preventing all those other horrific complications I spoke about earlier. It's really, really important to bring your weight down. Now, you can bring your weight down. Let me cover some of the lifestyle changes that are needed. Lifestyle changes include stopping takeouts or takeaways, as we call it. I'm not very popular with the takeout industry, unfortunately, but that's what's driving a lot of this. It's polyunsaturated foods, as we call it. It's intake of extensive amounts of sugar. Got to cut sugar out of your diet. You've got to cut salt out of your diet. It leads to hypertension. The one thing leads to the other. So a proper diet, and if you cannot get there yourself, I'd advise seeing a dietitian and setting an eating plan or a meal plan for yourself. Very important and has very effective outcomes. The second thing is exercise or becoming active. We've got, Sakina, very much a culture these days of what we call couch potato syndrome. These are children and young adults, anything from the age of 6 up to the age of 20, sitting on couches, playing TV games, 12, 18 hours a day, eating takeout, and these children become morbidly obese at a very early age. They are the classic profile to get early type 2 diabetes in their lifetime, and then if they don't manage it, their mortality is going to come to them a lot earlier than the rest of the population, meaning their life expectancy will be curtailed a lot earlier than the rest of the population. So it's a combination here. In conclusion, you've got lifestyle changes, proper diet, exercise, your salt, your sugar intake, things like stopping smoking. Those are the lifestyle changes. And in some cases, you can reverse type 2. If you can't, in conjunction with all those lifestyle changes, there's some very effective products. And as I mentioned, the most predominant and the one that's attracted a lot of attention is your GLP-1 products, the combination of GLP-1 and GLP products. And those in some countries are registered for weight loss and also for diabetic control. They're very good at controlling your blood glucose levels. You bring your glucose under control, you prevent all those complications, those horrific complications that I spoke about earlier.
But what are some of the challenges in getting some of these new treatment regimes to patients? Because it's all good and well to have them, but as you say, in some countries, can't just buy it over the counter. So what are some of the challenges, so to speak, Stavros, when it comes to the treatment landscape with the new products that are available?
The first thing is the best cure for anything, any medical condition, is prevention. So I'd like to encourage all the viewers to stay vigilant and to undertake screening and prevention. What is screening? Screening means if you suspect you're diabetic or you're presenting with any of the symptoms, such as you excessively thirsty, you are urinating frequently during the day or at night, these are just some of the indications that you might be diabetic or becoming insulin resistant. Then I would encourage you to walk into a corner pharmacy, and have your glucose tested. It can be done in literally a minute, and you will then have an indication. The pharmacy can then refer you to the appropriate medical practitioner should your test be one of concern. So that's the first thing I'd like to encourage. The second thing is all the lifestyle changes I spoke about. Don't wait to develop a problem. Adapt a healthy lifestyle now. Now, if you still end up getting type 2 diabetes, how do you access these products, Sakina, as you mentioned? And unfortunately, these products are controlled. They require you to present to either your general practitioner or a specialist, depending on the referral pathway, to undergo a full examination. These products require a full examination before they can be prescribed. Of course, the doctor needs to prescribe the right dose. So once you go to your doctor, these products are generally readily available in your pharmacy. There's been a significant demand and upsurge for these products. So there have been some shortages, but now there are at least 2 of these products on the market, and it should ease off the supply constraints.
All
But I
right.
do want to make one other very
I'll
important
tell you what,
point.
Stavros, we're out of time, and I actually want us to come back and speak more specifically to the actual products that are available. So let's put it on pause there for today. But thank you so much, Aspen Pharmacare's Group Senior Executive Stavros Nicolaou, speaking to us about type 2 diabetes and, of course, the treatments that are available out there, but also the common sense objectives in trying to tackle this.